Good afternoon. This is Dr. A with Angels Core Care, and I am a medical doctor who specializes in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to enrich how you feel about yourself and improve your quality of life. I'd like to thank you for taking the time to join us today. If you are here live, please type hi in the comments, and that way I know you're here. And if you happen to be watching the replay, thank you so much for taking the time out of your schedule to come back and visit. Please type a replay in the comments so that I know you're here as well. And lastly, if you have any questions, please feel free to post those in the comments as well, and I will do my best to answer them to the best of my ability. So my topic today is a continuation of medical weight loss, and in particular in response to a question that I received last week asking more about non-exercise activity thermogenesis, also known as NEAT, or easy ways to burn calories without actually having to exercise. So, two-thirds of Americans are overweight or obese, and I've said this several times before, and that means 2 out of every 3 Americans could benefit from medical weight loss. So, if you looked to the person to your left, and if you look at the person to your right, and if you look at the person in the mirror, 2 of the 3 people you just saw could benefit from medical weight loss, and I'm here to try to help facilitate that. There's so many complications associated with obesity: high blood pressure, type 2 diabetes, high cholesterol, heart disease. And my heart and passion is to really try to decrease the risk of those conditions and complications by helping with treating medical weight loss. In particular, I had a patient I saw just today who was actually able to discontinue her blood pressure medicine because she's lost weight, her blood pressure's gone down, she's off her medication, and I am so excited for her because that truly is a success story. But again, today I want to talk about non-exercise activity thermogenesis, which is also known as NEAT. So when we talk about this is physical activity. And first we want to look at NEAT inside the home. What kind of things can you do at home to increase your physical activity? Well, one of the things I mentioned last week was hide the remote control. A long time ago, if you wanted to change the channel on the television or if you wanted to adjust the volume, you actually got up out of the couch, walked over to the television, you pushed the button, you turn the knob, you had to do something physical in order to change that, and then you'd walk back over to your couch and you'd sit back down. Well, with remote controls, people kind of bypass that activity. And so I encourage patients to hide the remote control so that way it kind of forces them to get up out of their seat. Another thing that I mentioned last time is when going grocery shopping, carry 1 bag of groceries in the house at a time. You don't have to put 3 on this arm and 3 on this arm to try to make one step or one trip. Just go 1 at a time. You're going to get some extra steps. That's not going to hurt you, and that's going to be another way of increasing your physical activity. Another example inside the home is transition from cleaning the home to preparing for a VIP. And what I mean by that is we all know what it's like to kind of do the superficial cleaning, but what if we did a little bit more? Maybe go ahead and wash the dishes by hand, maybe instead of the dishwasher, maybe dry them off and, put them away. Those are just little steps of activities, helps keep the counter looking cleaner anyway, but a very good and easy way to increase your physical activity. So that's inside the home. So what about when you're not inside the home? What are other things we can do to increase our physical activity? One is when you go grocery shopping, you don't have to take the closest parking spot. It's okay to be kind of away from the other cars. Less likely your car's going to get hit to begin with, but those extra steps are not going to hurt you. In addition, maybe consider carrying the little basket thing instead of having to push the cart if you're getting just a few things, because having to carry it will actually help increase your physical activity. If you are taking public transportation, you can consider maybe getting off on a stop before the stop you need to get off on, and then taking a couple extra steps to get to your destination. Another example I mentioned last week is minimize the use of the elevator and the escalator. These are labor-saving devices, so to speak. And we used to say when I was in residency, you can walk up a flight of stairs or walk down 2 flights of stairs. So you don't have to sit there and wait for the elevator or escalator. It's okay to take those steps. Those steps are not going to hurt you. Another thing to do outside the home is simply play with your kids. Especially we're able to get outside now, throw the ball with them, kick the ball with them, walk over to the park, go on a bike ride, enjoy the great outdoors. It'll enhance your relationship with your kids and at the same time be great ways of just increasing your activity. And I mentioned before, aiming for about 10,000 steps a day. If you don't hit 10,000, that's fine, but any improvement in your step count is going to be beneficial for you. So tool number 3 is, what about just neat in general. What other things can we do to increase our physical activity without actually exercising? And one tool is to know that it is okay to fidget. If you're tapping your feet a little bit, or just ways to kind of keep your body moving. For instance, when you're talking on the phone, you don't have to sit down. You can get up and walk around, and you're just taking extra steps, but you're still carrying on that conversation. Another thing is if you're heading towards someone, you can walk to where they are. If they're relatively close, you can walk to them rather than calling them on the phone or texting them. And it'd be nice to see them face to face anyway. In addition, in general, try to do more standing than sitting. Maybe try to get yourself a standing desk at work rather than a seated desk. Just standing is going to have more calories being burnt. Just again, it's another physical activity. And so, to summarize, there's different things that we can do that are not exercise, but can still increase our physical activity and still burn off calories. There's things that we can do inside of our home. There's things we can do outside of our home. There's things we can do on a day-to-day basis, and just really look around and say, well, what can I do to increase my physical activity? And not that it has to be strenuous, not that you have to go out and break a sweat or anything, but just increasing your movement. So, if this information was helpful for you, whether you have obesity or pre-obesity or not, please type helpful in the comments. That way I know that the information is being beneficial. And also, please be sure to share this video. Again, 2/3 of all Americans could benefit from it. And my goal and my passion is to help fight the obesity epidemic and help people have a better and healthier quality of life. So imagine for a moment what your life would be like if we partnered together and tried to come up with a treatment plan for you to help improve your physical activity, to help you lose some weight, to help reduce some medications, to help maybe increase your energy level, maybe increase your flexibility, maybe just improve overall how you feel about yourself, or being able to look in the mirror and smile. I've had a couple patients who they had to get smaller clothes because they've lost weight, and what a problem to have to go shopping for new clothes because your size has gotten smaller. But imagine if we worked together and you were able to have these same kind of benefits. I would love to be able to help you. That's what I do, and that's what I'm passionate about. So we do have openings for new patients. If that's something you're interested in, you can give us a call at 614-442-2600, or you can go to our website, angelscorecare.com, click under services, and then you can click the button that says medical weight loss. So again, our mission is to help you get to your goals, to help you be healthier. And so I appreciate you for joining me this afternoon, and I will be back next Thursday at 12:30 p.m. Eastern Standard Time. Have a great day, and bye for now.